Okay, so for context of my video, a patient arrives to a clinic with complaint of dysuria and odoriferous and discolored vaginal secretions. The patient tells the doctor that she's concerned that she may have a urinary tract infection. So, right now, it is the doctor's job to help the patient distinguish a UTI from an STD. Because, although similar in that both UTIs and STDs cause dysuria, STDs cause an increase in foul-smelling, discolored vaginal secretions, where that is not typically seen in UTIs. It is also the doctor's job to be able to tell what the patient's preferred learning method is. You can do this by age. Older patients tend to prefer verbal explanations paired with pamphlets, whereas younger generations can be supplied with an emailed link or an online presentation when applicable. In this case, since the patient is in their mid-30s, we have determined that both verbal explanation and reading material best suits the learning style for this individual. Lastly, the doctor wants to assess the patient's readiness to learn. Sometimes patients can be so thrown back from their diagnosis that teaching them would be a futile attempt. The next plan of action for what you would teach your patient is to let them know what it is, how it's transmitted, how long it takes to present, how it's diagnosed, and honestly, what exactly is an STD, if they're dangerous, and you'll be able to have those answers ready for them in a way that they'll be able to understand without being overwhelmed. Going off of what was stated earlier, we really want to start with teaching the patient in a way that doesn't overwhelm them. Start with what an STD is. It's a sexually transmitted disease. Are they dangerous? Yes. If they're left untreated, they can increase your risk for HIV and HPV infections, leading to some cancers, such as anal and cervical cancers. How is it diagnosed? Just a simple swab test of your vaginal fluid is all that you need. It's not an invasive procedure or anything like that. If they want to know how long it takes to present, it sometimes doesn't show up at all. But if they do, it could take anywhere from 5 to 28 days to present and have the patient know what they have. It's transmitted through sexual intercourse. And what it is beyond just being an STD, it's probably one of the most common STDs. And it's actually caused by a parasite, trichomonad, and it affects your urinary tract, your vagina, and even your digestive tract. And you want to be able to say all this to your patient without overwhelming them or scaring them off. You want to just lay it out for them to have informative information to help them grasp what's kind of going on. It is also worth mentioning when you are teaching your patient, you want to be able to have clear and measurable goals for their learning. You want to be able to know what you're going to be teaching them so that you can assess how much they've learned, what else they may need to know, and if there's any deficits in their learning. As far as how the actual teaching will begin, you want to be able to have a positive environment for them. When you come back with those results or anything, you want to have materials with you to help them learn, such as like a pamphlet or something that you have to give them to physically hold and to read to facilitate better learning. You want to be prepared to go ahead and teach them and start that foundation of learning right off the bat. Not to overwhelm them, but to have the information needed to answer their questions should they have them. A question that your patient is no doubt going to be asking you as the doctor is, can it be treated? The answer is yes. It can be treated effectively with a large dose of Flagyl or Tindamax. You just take it with an 8-ounce glass of water and a full stomach, and it'll be a large dose, and usually it's one time. Sometimes you can take it over a course of a week if you're not comfortable taking a large dose, and that should clear up your symptoms. But a problem that we run into is it will just keep getting passed between you and your partner if you don't get your partner tested and cured. So it's always a embarrassing thing to bring up to come home and tell your partner that you have something, and as a doctor you need to know that, and to kind of come across the thing, telling the patient that, with the importance of, you really need to be able to, it's not an easy thing, but your partner really is going to need to get treated as well, so that it can be completely eradicated instead of being passed on through. Another thing is, they might want to know if somebody can tell that they have it. And unless you have a partner like noticing that your vaginal odor is completely different, smells fishy or such, nobody can just look at somebody and know that they have an STD. And you can rest assured that your private business won't be known to others. Now, if your patient is pregnant, you want to educate them on the risks of trichomoniasis. When they're pregnant, the risks are different, although still very important to get it treated when you're not. When you are pregnant, you're at risk for a premature rupture of your membranes, you're at risk for going into preterm labor, two very serious things that you definitely don't want. So you will be tested if you're pregnant at your doctor's office to make sure you don't have it. And if you have a pregnant lady come in and find that they do, that rest assured that they are still allowed to take that Flagyl, they're still allowed to take that Tindamax. They can still take it in large doses, and they will be cured. It's just important to be proactive on that and to get that taken care of as quickly as possible. Another question that your patient might have if she's pregnant is, what are the symptoms of trichomoniasis in pregnancy? Are they different from if she wasn't pregnant? And the answer to that, as their doctor, is to inform them that no, it is not any different. Although the outcomes can be a little bit more severe and detrimental to the fetus that you're carrying, if you have trich, the symptoms are the same. You have an itching, burning genitals, a burning sensation when you pee. You kind of have like a fishy smell to your vaginal secretions. Sometimes you can even have pain during sex. Your discharge will be white, gray, green, yellow, just definitely an offset from the normal. And when you're pregnant, you already have a lot of extra secretions, so it's just important to keep an eye on the color and inform your doctor if it's completely different. And you really want to be able to, as an educator and as the doctor, informing your patient of this to calm their nerves. You want to be able to inform them that what they're going through or what they may go through can be controlled, is under control, and that they have nothing to worry about. Lastly, you want to be able to have the patient teach back information given to them to ensure they have a full understanding. Go ahead and ask the patient if they have a full understanding. And if they don't, try to find a way to reiterate what you have taught them in different terms, or try to find different learning materials that can help them. You want them to be able to fully understand how it was transmitted, what it is. They know how it's treated. They know how to take the treatment plan, the medications. They know how to take them, what the symptoms are, so they'll be able to look at it. They really need to know the importance of bringing their partner in to get treated, because it's obvious that they have it if they've been sleeping with them in the time that they've had this. It's very important to make sure your patient feels confident leaving the doctor's office, knowing exactly what's going on with them. They have answers to all their questions that they have, and to make sure that you're giving the information to them in a manner that they're able to really understand and soak in, rather than getting bombarded with all these different informations that they're not fully comprehending. And you want to be able to assess your patient if they really understand, because a lot of times patient, yeah, I understand. They'll say, yeah, okay, I get it. And then they go home and they have no idea. They don't take the prescription right. They don't get their partner treated. They don't know the symptoms to look for. They really don't even sometimes know how it's transmitted, and it just happens again. And you need to make sure that they're being honest with you when they say that they understand. And that's why we use scientific-based research when we're teaching, so that we know that we are giving them the optimum amount of teaching materials and the type that really helps them learn and grasp the information that you're giving them, so that they can walk out feeling confident, and you can feel confident that you have done your job correctly and that they know what to expect and how to treat it and how to take care of it and to bring in their partner and stuff like that. That's it for my video. Thank you. I'm sorry that I did not have anybody to help me with this video. I'm sure it would have made it a lot easier and a little bit more bearable to watch, but hopefully I was able to follow the rubric and do as I was supposed to, and to have everything and all the information included that was required. Thank you.